guys. Hey, if you like this video, please click like. And if you'd like to see more of my videos, please subscribe. It would certainly be appreciated. Thank you. Hi everybody, it's Momma Eadie. And today I want to talk to you about 9 conditions that your dog or cat even have that must be seen by a veterinarian. Now, you all know I'm not the greatest veterinarian person. I try to do home remedies as much as possible, but these things is a must if it happens to your dog. And the first one would be difficulty in breathing. If you see that they've increased breathing rate or an increased respiratory effort, they should be brought into a veterinarian immediately. So things like pneumonia, congested heart failure, heartworm, severe anemia, or disease of the pleural space, which is between the lungs and the chest wall, could be affecting their breathing. So a veterinarian will need to monitor your pet closely, perform physical exams, and run tests to determine the cause of the breathing difficulties. So that's your number 1, is difficult breathing. Number 2, severe vomiting or diarrhea. Most people generally would know this, but if they are, vomiting and diarrhea, it could be common causes of change of diet, eating too much or too fast, or eating that spoiled Taco Bell burrito they found in a park. But frequent and severe episodes of vomiting and diarrhea in pets can indicate serious medical issues, especially when accompanied by symptoms like being lethargic, or lying around, doesn't greet you at the door, or it's hiding, pain or pale gums. Diarrhea and vomiting can be caused by dysfunction of many different organ systems, like the gastrointestinal tract, the pancreas, the urogenital system, or the liver. You can always lead to severe dehydration with all this going on. So make sure you take your dog to a vet if it's continuous vomiting and diarrhea. An inability to urinate or to have severe constipation, I guess would be the easiest way to put that. If you see that they're not urinating as much as they should, or defecating, if you're not seeing urination within a 4 to 8 hour time span, this is a sign that the pet should be taken to a doctor. And through that time frame, you may want to keep track of how much they've drank and how often they've typically urinated, and if the pet makes frequent attempts to urinate without being able to do so, something is up. With defecation, you should be aware of any deviation from your pet's normal habits, vocalization upon urinating or defecating. In other words, if they're howling or squealing or whatever, should be particularly alarming, as it is a means your pet is likely in pain. A complete blockage of the urethra or colon in the case of constipation. These symptoms can stem from infections, tumors, psychological or metabolic disorders, lesions of the spinal cord, and more. So make sure if they're doing this kind of activity, you see this in their dog, get them to a vet immediately. If they've got active bleeding, that's pretty obvious, but most people, if they've cut themselves, severely, of course we know that they'll cut and get little scars and stuff, but as with vomiting and diarrhea, degree of severity is important to note here. If a pet is bleeding profusely, covering the room with a gauze pad and applying pressure to it. Check after a minimum of 3 minutes. If your pet continues to bleed after several minutes, emergency care is the best resource. Any active bleeding should always be investigated. It can be a result of traumatic injury and require surgical treatment, or it could indicate an abnormal clotting ability or other systematic disease. If your pet's blood is not clotting properly, expect your veterinarian to run a number of tests before implementing a course of treatment. If it's got bloating going on, a distended abdomen, I can't even say the word, it's extremely important to get it checked right away. It could be associated with a food bloat, but it could also be seen in a patient with a large amount of abdominal effusion, free fluid, or gastric dilation and bolus. It's especially important for large dog owners to be observant of these signs. It is most common in large breeds. Dogs presenting with this problem can be restless, in pain, retching but unable to vomit, and treatment for this includes fluids, oxygen therapy, gastric decompression, and surgery. So, if you see this abdomen getting bigger and bigger, you get them to a vet. It could be several different things causing it. Of course, I'm sure everybody knows an inability to stand or walk. You take them to the vet and hope they can find what's wrong with them. If a pet is unable to stand or walk, immediate care should be sought. There are many reasons for your dog or cat that might have trouble moving around, such as neurological conditions relating to the spinal cord, the brain, or the nerves, cardiovascular conditions such as severe anemia or heart failure, or metabolic conditions like electrolyte disorders or hemoglobin, I don't know what that word is. They will examine your pet better to understand the extent of the problem and its underlying cause, and it will run a number of tests to come up to a definite diagnosis and determine the appropriate treatment. That also includes if they have cancer on the bone or in the spine, which is what I think Shadow had. Of course, like I said, my vet was a lousy vet and didn't catch it, so we're not going there no more. Seizures. The most common cause for seizures, usually under the watch of a good veterinarian, they manage just fine. However, seizures can be a symptom of other serious issues, so it's best to seek immediate care if your pet experiences a seizure, particularly if it's the first time. Seizures can present a variety of forms depending on the severity. With focal seizures, pets may simply twitch or bite at themselves, but the more serious grand mal seizures are associated with a loss of consciousness from the pet, involuntary movements like paddling, and possible urination, saliva, and defecation. Causes of seizure vary from diseases and toxins to infections or inflammatory causes or tumors. If you bring your pet to the vet following a seizure, they will typically conduct a full physical and run a battery of tests. Medication to reduce seizures in standard treatment for epilepsy, but other treatments could be required depending on the diagnosis. Now, I had a dog, it was actually my son's dog, and he had severe seizures, and I started him on protein and natural sugar diet. He got an egg once a week, a cooked egg. I cooked it in a microwave, and a half an orange every day. Now, if they don't eat orange, you can try strawberries or, whatever fruit you can find that they will eat, except for grapes. No grapes. And you do this every day. In this case, it worked. He came out of it. He was an older dog. He came out of it. He started running. He started playing. Never had seizures anymore. So you might want to try that before you completely give up on him. Known trauma or potential poisoning is another problem that you might want to take your doctor to. If you know your animal, your cat or dog, has had some kind of traumatic incident or has been into something that shouldn't have been, emergency care is crucial. As the old adage goes, it's better to be safe than sorry. Absolutely. He cites a snake bite as an incident that requires an immediate trip to the vet. If the pet is observed eating or chewing on any potential toxins like human medications, plants, cleaning products, or foods such as chocolate, we recommend contacting the Pet Poison Helpline or the ASPCA to determine if you need to seek immediate treatment. Pets who have ingested particular dangerous substances may require extended critical care and can die if left untreated. That traumatic event, such as being hit by a car, should always prompt an emergency trip to the vet. Even if you don't see any obvious signs or injuries or distress, there's internal injuries that could happen, such as bleeding into the abdomen or chest, lung contusions, bladder rupture, or fractures. You know, just all kinds of things that could go wrong that we can't see visually. And they may not even react to it. I mean, you may not see no blood or anything coming out of the stool or anything, but they have something going on in the inside that could kill them. So that is definite. Yes, you got to do that. And the last one is if they're not eating or drinking, which is probably pretty obvious to everybody. If they have observed approximately 1 day of not eating or drinking, depending on your dog or cat's usual appetite behaviors, there are many medical possibilities. If your pet is refusing food or water, including cancer, liver disease, or kidney disease. Also, the lack of appetite can suggest fluid within the lung cavity or abdomen, which can be a true emergency. On the flip side, excessive drinking as an issue requiring quick care, as it can be a symptom of uremia or kidney disease. Pets exhibiting any of these behaviors will need to see a vet sooner rather than later, where they will undergo a full checkup to determine the cause of their symptoms and appropriate treatment. Okay, that's it, guys. That is what you got to do. If you've got a dog with any of the symptoms, you get them to the vet immediately. I'm sure most of you would, but there are some of you that would doubt that they would need to do that right away. Now you know. They could be very serious. And of course, I love you guys. I want you to subscribe. I love my fur babies. And bye-bye.